And I'm Jaya Mathai. As I said, I'm a psychiatric nurse practitioner working in Texas. Actually, my specialty is I see all the age between from 3 above, but mostly I'm specialized for pediatric. So today I'm going to talk about suicide. Before I go there, thank you very much to Dr. Jaya Mathai to giving me this opportunity. And yes, the audience, without you all, nothing is possible. And I would like to give thanks to Dr. Sini Abraham, and who is my mentor for all throughout my career journey, and she's still helping me. I work with Dr. Sini Abraham, Rockwell Psychiatric Clinic, and why I choose this subject, suicide. You all know, day by day, the rate of suicide is increasing. Doesn't matter the age, gender, or what is your background. So let us talk about it. But before I start, I would like to tell you that I'm showing the disclaimer. This talk addresses the topic related to suicide and mental health. If you or someone you know is struggling or in crisis, please seek help immediately from a mental health professional or trusted individual, or contact a crisis helpline. The information provided is for education and awareness purpose only and is not a substitute for professional or medical advice or diagnosis or treatment. Remember, you are not alone and help is available. So let us talk about suicide. One word, suicide. When we heard, we always thinking that whoever is going to commit suicide is thinking that that is the solution for their problem. In one word, it is a permanent solution for their temporary problem. They are not aware that there is a lot of solutions are available. That the moment they are in the thoughts of suicide, they just feel, what they feel. They are thinking that all the doors of happiness is closed. There is nothing else. Only the suicide is the only solution for their problem. And at the same time, it's funny to think that, they feel like when they have the suicidal thoughts, they feel they are already trapped. There is no way to get out. And they are thinking the suicide is end of their problem. It is not the end of their life. After suicide, there is some relief from their problem. There is some good thing is coming after the suicide. To the next one, it's myth about suicide. We all have some myth about suicide. When we think about suicide, when I'm thinking back, during my nursing school, I studied in Patna. In that time, I don't know, maybe you all in 80s, 90s, we believe that when we ask someone, do you have any suicidal ideation? We are scared to talk about suicide because we are thinking when we ask people about suicide, we are giving them, it is triggering their thoughts of end of the life. But, we need to change it. That is not correct. And another thing also, we always thinking people, it's correct, yeah. People who talk about suicide are just seeking attention. And, I can say a lot of examples, especially among teenagers. The parents are bringing the kids and they're telling, because of stress from the exams, they just say they are not going to do it. They need some special attention. That's what they are talking about that. Then another thing is suicide cannot be prevented. There are a saying that when people who is talking frequently about suicide or they have a family history of suicide and multiple attempts of suicide, anyway, whatever we are going to prevent, they are going to do it. Then another thing is people who take their own life are selfish or weak. This is one way the moment when they are conducting, they are performing suicide, they're only thinking about themselves. That's correct. But at the same time, because they are trapped in their feelings, their hopelessness, it's not like they are not thinking about others. And there is a, the weak, this, I can say a lot of things about this weakness. That one thing I can say that, when we think about a soldier, veterans, they are physically strong. Am I right? And then at the same time, we are thinking they are emotionally also strong, but it's not correct. You know why? I will explain more about the brain in the next slides, but I'm just summarizing it here now. Like, in young age, this our teenagers going to military in their young age. So that time, their brains are not fully developed. I'm not talking about the brain structure. I'm talking about the impulsivity, behavior. All these things are not fully developed. So when they're exposed to the trauma situations and their capability to handle stressful situation is weaker than another general population. So it doesn't mean that when you see someone is physically strong, but at the same time, their pain tolerance is very high too. So that is the one thing, and you cannot look at the people and say, oh, they are weak. That's what, or weak people don't do. We cannot come a conclusion like that. Then another thing is only people with the mental health condition can be suicidal. This also I'll be explaining in detail. And the next one is, once someone is suicidal, they are always suicidal. It is not correct, because when we find out the reason for suicide and we help them and provide the correct treatment, they can. I have a lot of patients with multiple suicidal attempts and they are living happily without suicidal thoughts now. Then another thing is, most suicidal happen suddenly without warning. This is also like a controversial, because yes, some conditions are out of impulsivity, that also I'm going to explain. Some condition with the out of impulsivity, they will go and do it. But some cases, they pre-planned everything and they go and they go and commit suicide. I'm sorry, I have some throat issues today too. And another thing, young teenagers. Yes, there is a saying that the second death reason, the rate of suicide among the teenagers are very high. The age between 15 to 29 is the second highest rate of suicide. But it is okay. But at the same time, the current studies showing there is a lot of ladies and there is a lot of geriatric patients also committing suicide. When we look at, we can see the rate of suicide among the female is high compared to male, but the rate of successfully completing suicide is high in male than female. Because it's why? Because the mode of what they are using to commit suicide, especially female, they don't go with the vigorous activities. They may use some drugs or they may drown. So they get opportunity to get people's attention and they can get help. But usually, man, they may shoot themselves or they harm. So in that, the people come to know about it late. It's very, sometimes the people found out after they end their life. So that is the reason, one reason. Then another thing is, mental health personnel are the only one who can help. It's not correct. Why? Why this? I'm doing this now. I'm doing this now to give awareness to the. I'm so sorry. I'm doing this for the community, because to give awareness to the community, because mental health professionals are around us but not around us always. So who is around us always? Our friends, our family, and our co-workers. So like, it is very important for them or we all to know what are the warning signs of suicide, how we can help at least one life. Then another thing is, after failed attempt, a person won't try again. This is also not correct. I can say from my experience, I see patient with multiple attempt in a daily basis. And another thing is, reduce the access of firearms don't work. Yeah, it's same like, one suicide, or they are, or he or she is planning to do suicide, whatever we do, whatever protection, they will do it. It is not like that. For example, the suicide out of impulsivity. So all of a sudden, some thoughts came, they are looking for something. If some things, firearms or things to end up their life, if that is available, they go and do it. But if the firearms or things are not available, they get time by looking at, they get distracted. And even, that little moment of deep breathe or distraction can distract them from the thoughts of commit suicide. And prevention, that's what we are here now. Prevention is better than cure. As I said, prevention start from the kids. We have to start to educate our kids about suicide. At the same time, about suicide, I meant to tell them the importance of life. How precious is the life. And in up and down in life is normal. There will be, life is a mixture of happiness and sorrows. Look at the nature. There is 4 seasons. So I don't like winter, but I have a hope. The spring is coming. The summer is coming. So same way, when we look around, there are stress in life. It is not going to be stay there forever. This time will pass. And that is the goal and motivation we have to provide and teach our kids anytime. If there is, no means next door to open. Or if there is some issues happening, tell them that this is a free experience for you to be physically, mentally strong. In life, there is always issues and problems. You cannot run away from that. But when you face some, if your grade is little low, some issues happening, some trauma issues, anything happening, don't stuck on that. Try to come out. And this problems is going to make you stronger and stronger. So it has to start among the kids, then to the community. Always prevention is better than cure, and better than the suicide happening and ending the life. Together we can help the community to avoid suicide. What happens in a suicide brain? Like a brain, when we talk about suicide, I have to say there is a lot of controversy going on about suicide. Suicide is not a disease, but suicide is the after some mental and physical issues happen. This is the byproduct or end product of some physical and mental health issues. So what happened in a suicidal brain? So that's why I'm telling, somebody suicide, their attention seeking. So we all have to understand what is happening in a suicide brain. There is a lot of neurotransmitters in the brain, especially like a serotonin and the norepinephrine and dopamine. Serotonin always work with mood, like a depressive patients. There is imbalance of serotonin that cause hopeless, useless, negative feelings. And norepinephrine, it help you to concentrate. If your concentration is not good enough, so you cannot concentrate on good things in you. Then dopamine is the hormone, is giving you happiness. So there is some imbalance of that also lead as depression, hopeless, useless, and trouble with impulse control too. And another important part of the brain is prefrontal cortex. And there is some reduced activities in the structure. Prefrontal cortex is the place where our judgment, our high functions are mostly controlling, and our impulsivity also. If there is some problem there, there is lack of impulse control, lack of judgment. In coming slides, I will be explaining about what all things are affecting the prefrontal cortex. And another thing is the limbic system. overactivity of limbic system. Like amygdala, that is the hinds emotion like fear, sadness, and hopelessness. This also can affect our suicide thoughts. And the stress and trauma, like a chronic stress, that also causes changes in our brain structure and imbalance in our neurotransmitter and aggravate the suicidal thoughts. Then overall, the changes in the brain can cause negative, fill up with the negative thinking. And because of that, always the feeding the negative thoughts, they don't know how to replace with the positive thoughts. Then worthlessness, hopelessness, and these negative thoughts are kind of fuel for the suicidal ideation. Next, then another thing also, like as I said, functional changes can cause suicide. When we have some increased pain and some life-threatening situation. In that case, what happens? Same like when there is severe pain and chronic life-threatening situation, there is changes in the brain activity. Reduce the volume of the gray matter. Gray matter is the place where our sensation, again, our impulsive control and good thoughts, all this. So there is changes in that also aggravating the suicidal ideation. And people has got disabilities, they are like maybe I can see a lot of people who had motor vehicle accident or life threatening situation. They cannot be active as before, or some of them are bedridden, or they need help from the people. In that situation, they think, oh, I'm burden for the people, or I'm burden for myself, I'm burden for the whole world, so just end up my life, maybe people around me will be happy. Yes, my favorite part. Reason for suicide among kids. We need to be, our future. Our future is in our kids' hands. So we have to give them a safe environment to grow. And, there is a lot of issues going on uh, in this digital world. Kids mostly stuck up in a room. They are not getting a lot of chances to mingle with nature, mingle with the people. So end of that, we can see a lot of mental health issues among the kids. That is mostly anxiety and depression. And when anxiety, depression not treating, when anxiety, depression not treating, then it's causing uh, suicidal among the teenagers. Then, another thing nowadays, in our time also there was bullying, but we grow up with, you know, big family or joint family. So there is a lot of comments we are getting from the family, from neighbors. So when we go to school, there is some negative comment. It is not touching us that much. But nowadays, the nuclear family, one or two kids, they have less exposure to this kind of stuff. So the bullying and social isolation and social exclusion and peer pressure, there is a lot of, and this is America. When we think about, it's a multicultural. So there will be always something, knowingly, unknowingly, for funny. Kids pick on each other. Then, they take it seriously. So as a parent, we have to educate. I always tell them that the kids who is passing you some negative comment, bullying, that's not your problem. That kids has got some problem. That the kids is putting that in you, his problem. So you are even with the violence and even some traumas. Yes, you are not a victim. You are a survivor. And another thing is family problem. Unfortunately, because even recently, one of my friend back in India, she told me that because one of the reason they are facing is a sexual abuse from family member, neighbors, friends, because both parents are working now and kids are unattended. So luckily in America, below 12 cannot be alone, there will be some adult to take care of them. But I think that has to be done internationally. Then, yes, that is there. So parents got divorced. then they fight the care for who will take care of. And um, I'm so happy to say that I can see in a daily basis in America, even after divorce, the parents are equally responsible to take care of the kids, and they are very good. And I forgot to tell that also in with the mental health issues, I can see a lot of parents are taking care of the kids in their young age. They notice and seek help immediately, and that I'm not seeing among other community, especially Indian community. They ignore it most of the time. They are not understanding what are the stresses the kids are facing in their daily life. And yes, and especially after divorce, I can see they are fighting. They are, one maybe provide more than the other one. There is a competition. They are not looking for the healthy atmosphere, providing the healthy atmosphere for the kids. Another thing is academic stressors. Uh, Here in America, there is academic stressors, but compared to that, I'm seeing a lot in India, because everybody has to be get top, 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 and I'm not blaming them. If they are not getting all A plus, they cannot get admission to a prestigious college. So I think yes, there are things need to be changed, but I'm just putting that in you all. Work on it. So, you know, A is not the end of life. A plus is not the end of life. I can see that the the my classmates who were on the top, they didn't reach. There are so many. They didn't reach the level they want because they were only bookworms. So I can see a lot of my classmates, even they were not in top, they reach to their goals. So let the kids to be free, let them learn from experience. And think about our time. Our parents were not that much strict with us. They gave us freedom to choose and study. And vacation time, we don't have anything to study. Or Saturday, Sunday, we are free. But what about our kids now? One after another, extracurricular activities, tuition, this, they are not getting time to breathe. So stop the competition among the kids. Then, as I said, exposure, violence, and trauma. Because of nuclear family, parents are not there to take care of the kids. They are going through a lot of traumas and violence. And another thing, the new thing, social media and cyberbullying. This is beyond imagination. You never know, because we are giving smartphones to the kids. And yes, I did a YouTube video about cyberbullying. You can go and watch it. But I'm telling that, the parents has to be controlled over their social media, what they are doing, where they are going. But in a kid has got there's a lot of kids even here in America, they make international friends. We don't know. I'm telling, on the other side of the screen, if you don't know that person personally, don't make, even adult, don't make friendship with them. And you don't know what is on, who is on the other side, what is their intention. If someone spending time for you in the midnight or after hours, so I don't think that person has got a good intention. If an adult, who has the time to do that? If a kids, they have their responsibilities, who has the time to spend time overnight for you? And with social media, negative online interaction, there's a lot of game. you know Kids are trapped with that games. They're sitting there doing over and over and over. Most of the games are so violent, and that's the one reason the kids, they are losing that emotion. Even social media, when we are passing some comment, the next comment is kind of argument and fight. But when we look at someone's eyes and talk, we can see how our comment or our talk is impacting to the person on the other side. When we say something, oh, I think what I say, that is not good, I hurt his feelings. We can see that on the face and eyes. But when there is a screen, we don't know how the person is taking it. Is it good or bad? And another thing also, whoever is sending the comment also is going to be more stubborn. They are also losing their emotions. They become emotionals too. Then there is a lot of people, I know a lot of kids get into trouble when someone adult who they are thinking they are a respectful person or they are good. So they ask the kids to do something inappropriately. They do it. Then later, as they grow, they come to know that, oh, that was not appropriate. Then whole life, they're living with guilt. Then sometimes going to severe depression and they commit suicide too. Then another thing also, there is a lack of support, limited access to mental health. That's what I said that especially in our Indian community, we need to seek help. And there is some genetical and biological. If the family history of suicide or the family history of depression, there is more prone for uh, for the kids to get that. So that's what when a parent is about to commit suicide, think this is not only your life, this is going to follow through the generation to generation. So think about it. When someone has got suicidal attempt, seek help immediately. Next one. Then mental health condition cause suicide. I'm just rushing it, as I said, depression, sadness, hopelessness, worthlessness, emptiness. Then bipolar disorder. Bipolar is the combination of depression and manic. When they are bipolar, when they are depressed, severe depression, they may commit suicide. Manic, that is the stages of impulsivity. They cannot control their impulsivity. They go and do it. Then other schizophrenia like psychosis, they are hearing voices. They hear all these negative voices. The voice, I can see that a lot of patient telling, the voices is telling me to do it. You are not good enough to live. Go and kill. Then another thing is personality disorder, borderline personality disorder. They also, borderline personality disorder, ADHD, this all also do with impulsivity and some attention seeking. Then trauma, post-traumatic stress disorder. It can be physical, mental, emotional, or sexual trauma. The people who go through the trauma, they are thinking they are the victim always. There is no way for them to get out of. You know, uh, I can say a lot of things in veterans. It's you can see that when the flashback and then they get the nightmares, they feel flashback means they are re-experiencing that trauma. So that is so painful. And in that, to get out of that pain, they go and commit suicide. Then another thing is substance abuse. As I said, the alcohol, any other drugs, it what does it? It affects the prefrontal cortex and the impulsive. The most of the people using, if someone is using alcohol, drug, maybe they're self-medicating for their mental health issues, especially for depression. So when they use excessive amount of drugs or alcohol, their emotions, issue with their emotion, and they become their impulsivity. They don't know how to control their impulsive. So they go and act on it. Next. Oh, another thing also OCD. OCD means a rumination, intrusive thoughts over and over, over and over. They want to get rid of it and they go and do it. And the factors that increase the risk, as I said, past suicidal attempt. We don't have to be like a past suicide. They are going to do it anyway. Not like that. Past suicide, they have more chances to do it. So help them. Then as I said, substance abuse impaired the judgment. The people who are using substance abuse are more prone to do it. Then chronic illness, some kind of chronic pain, cancer, this all cause feeling of hopelessness and uselessness. And social isolation. We all are human being. We are social being. In this moment, I like to say talks about, this is Mental Health Awareness Month. So mental health awareness theme for this year is more good days together. Why together? We all are social being. Human being is a social being. We cannot be isolated and find happiness. So when there is some social isolation, it leaves loneliness and some love failure. So, there is a lot to talk about actually, we have to, when we are in a relationship. So if you find that relationship is not good for you, it's a toxic relationship, put barriers and boundaries in that, and then after that, don't you isolate. Okay, concentrate your strong side, positive side, that is good. Be responsible for you, that is good. But at the same time, try to find some good relationship where you can have positive thoughts, to have a lot of motivation to get. Okay, then another thing, yes, financial hardship, unemployment, and you have family financial issues, no way to, we can see in a daily life, especially in Kerala, it's a lot of families committing suicide together because of financial issues. So always try to leave what you have. Don't try to do a lot of luxurious life, and in a situation you cannot survive from that. Then the family history of suicide as psychiatric. Yes, these people need a special attention. And the people, as I said, has access to firearms. When they have that impulsivity, they use it. Then some special, cultural discrimination. Oh, I'm like this. I'm this special caste culture. I am not getting any respect. There is no point to leave. Then yes, relationship issues, family marriages, and some medication. Here, as I can say about the psychiatric medication, some medication, for example, you are taking some medicine for depression. So it takes 4 to 8 weeks to work. But at the same time, you will get some energetic, you feel little bit motivation, but you still have the suicidal thoughts and hopeless thoughts in you. Sometimes this medication can aggravate your suicidal ideation. So the people who are taking medication has to be, we have to be protect them, like keep away all the firearms, and talk to them, because medicine need time to work. How, as a community, how we can recognize the warning signs? So being attentive to warning signs, there are some people, they always talk about, they feel hopeless, they feel trapped. Be vigilant with them, support them. And sometimes even people say that, I want to kill myself. And we say, oh, people who is telling they are not going to do it. It is not like that. They are indirectly seeking help. Then another thing also, all of a sudden you can see someone is very active, all of a sudden is withdrawn, isolate, not interest. You can see in a lack of sleep, poor appetite, and nothing do, inactive. And then another thing, you can see that all of a sudden they are giving away their possessions, for their loved one, or giving away. And some people, some sudden mood swings, that's especially in bipolar cases. Then, as I said, changes in appetite. Then you can see that, there is sometimes the anxiety, they feel trapped. They self-harm themselves to their anxiety, and the depressive pain is so bad. So when they do cut themselves, they don't feel that pain, because their pain, the internal pain, is much more harder than the external pain. You can see the kids coming multiple cut, cut, cut. I'm like, no pain? No, they don't. After cut, they feel relaxed, because they are feeling relief from their internal pain. Sometimes this cut can accidentally go too deep, end up with suicide. So the kids who has self-harm history also, we have to be, oh, they're only seeking some attention, not like that. And sometimes they have the suicidal ideation too. So we never know. So we have to pay attention to those kind of people. Excessive use of drug and alcohol, and yes, always feeling worthlessness and no feelings, those kind of kids too, or those kind of people. Next. Oh, and one more thing I forgot to say, that the vitamin D deficiency, thyroid hormone abnormalities, hormonal imbalance, these all are the other factors we have to check. And next one, what can we all can do? How can they help them? Especially when they are, someone is coming and telling us, when we are seeing all this, what I say, you are seeing in someone. Okay, always, if they are not in active, If it is active, yes, call whatever the crisis line, suicide crisis line in your country, or get them into the hospital, admit to the hospital. But if they are just talking about, just listen to them. If they see with a compassion, create a safe space for them to share their feelings. Ask gently, you know, what is going on? Are you feel hopeless? Because sometimes, it's like everybody, people don't talk to share with anyone. They may need somebody is professional, they can handle it, or they like to talk to a trust person. So you all think, are you trusted to anyone, or you think, do you feel anyone trust can share? So always we all have someone there to share your feelings, your problems, and encourage professional help. It's always then, it's no one is there, share with the family, friends, but always it is go with the professional that is unbiased, because your family only focusing on you. But if you go to a professional, they will look your environment, surroundings, they will help you to come out the best options. I can say that, even it's not only for a suicide or anything. If you have any issues at any time to handle the situation, I can happily say that I'm with the people around, a lot of people to help me. You know, I went through my mother's loss. So Dr. Saji was there to help me to talk and to help me to come out that. So this opportunity I'm using to talk about the relief corner also. This is working nationally. Anyone from all over the world can seek help to Reliefcorner. And another thing also, express concern and care. And just show that, it just sometimes you don't have to say anything. Just sit, hold their hand, listen to them. And another thing, s- provide a, create a safe plan, identify coping strategies, and some emergency contact number. So if the person who has prone to or the suicidal ideation, they should be well equipped with the resources what they need on the time they are in a situation. And yes, when someone is telling first step, remove all the firearms, and involve, it's not bad to involve the family, friends, because it's a teamwork. When patient coming to me to the clinic, then I cannot be with them for 24 hours. Who is with them 20? The family. So we have to have a mutual understanding and a teamwork together to save someone's life. Yes, if so, as I said, if someone is in an active suicidal, see, help them admit in the inpatient mental health or nearby hospital. Seek help immediately. Next. Yes, is recovery is possible. Yes, it is possible. As I said, you know, most of, maybe sometimes we have to find the reason, and most of them may not need medication. We don't know. So the first step is seek help immediately. Find the reason for what is going on. And the reason may be hard the first time. So first seek help, listen to them, and psychotherapy is a good option to explore what is going on. There is a cognitive behavior therapy, DBT, dialectical behavior therapy, and when you seek help for a profession, they will let you know what kind of or how long you need the therapy. And this will help you to replace your negative thoughts with the positive and some coping. It's people who is with the trauma, the therapy help them to face it, not to run away from it. Any problem in your life, the therapy help you to face it, not to run away from it. Then another second option is medication. We use a lot of medication, antidepressant or mood stabilizer. It depends on, you need a one-to-one consult with a psychiatrist. And, as I said, there's a lot of mental health issues for the suicide. So according to your diagnosis, the treatment will be according to your diagnosis. Then in severe cases, you need to admit in the hospital, because when people get, oh, admitting the hospital, because as I said, life is so important, and this medication need time. If you are in an acute suicidal situation, you need acute management, 24 hours observation by a mental health professional. That's what we are asking you to admit in the hospital. Then uh, something, yeah. First step, I said that when someone is telling suicide, remove all the firearms. Then next one, build support, family, friends, community, organization, and create a safety plan. Recognize the warning sign and help them to recognize the warning sign and seek help immediately. When a patient coming to me, end of my consultation, I always make them, if they are in a suicidal thoughts, I always make them to promise. Promise me. I usually see if it is an acute case next week or after 2 weeks. So I make them promise to notify me. Promise you are not going to do it, or notify your parents. Seek help, because always sometimes they are in a acute suicide, they cannot keep the promise. So at least today you are not going to do it. Promise with your mom, or promise me you will be open up to whom you feel trusted. Then yes, the main issue at last, the first visit, or you cannot dig on the problem. Then find out the reason why. As I said, suicide itself is not a disease. It is the end product or contribution to some physical mental issues. So find out the reason and take care of and treat that. That is the most important thing too. Moving forward with hope. Yes, hope. You can see that I'm wearing an yellow dress. Yellow is the color for suicide. Since, if I'm not mistaken, I think since 1990 or something, there's a teenager committed suicide. Then they choose the yellow color for the hope, to help, to give a positive uh, motivations. So yellow means it's a hope, seek help immediately, provide help and motivation. So hope, remember, no one is alone in their struggle. By understanding the sign, offering compassion, and encouraging professional help, we can all contribute to saving life. Prevention begins with education and awareness. Yes, today, let us teach our children and young people that life is precious, and including the adult too. Everyone say that life is precious and that challenges can be faced with resilience and support. Together, we can create a society where anyone feels valued, understood, and supported. Next. Yes, life is a beautiful gift. Yes, any religion, or if you don't believe in any religion also, most of the religion is telling life is beautiful. Even if you are not in a religious person, also look at the nature. It's so beautiful. There is a lot of things to enjoy. There is a lot of things in our life yet come. Don't think about the negative. After a negative, there is a positive. So life is beautiful. Life is a beautiful gift. Let cherish it and help others to do the same. Remember, no matter how dark things may seem, there is always hope and help available. You are not alone, and brighter days are ahead. Reach out, talk to someone, and never give up. Your life is valuable. Yes, we all have a precious and beautiful and valuable life. And the person I'm talking, you don't think that I never had problem. We all have problems. The problems are spices in life, and our body is created in such a way to face the four season in the nature and struggles in life. Okay, when there is problem comes, always say this time will pass. Even in the good time also, always has a thought, this time will pass. Next. Okay, yes, hope. And if you guys has got any question, welcome to ask questions.